For us, myself working in an acute environment and also seeing the whole process of the stroke care pathway, the most important thing is about changing the public's perception and the staff's perception that stroke isn't inevitable of old age. It is something that is a medical emergency, and actually it's about getting the right care at the right time. And often for our patients, I think if we could slightly change the care they get based on what is recommended in the national strategy, we could see a change in their whole care pathway. They won't, the likelihood of being disabled or being in residential care after their rehab is going to be less likely. So, we're in full support of that.
The major opportunity through the stroke strategy is to redesign the whole pathway for patient care. And we know that English stroke services compared with other nations' stroke services are really quite costly and not as effective or as efficient as other nations' stroke services. And we spend about £7 billion a year on the whole stroke care pathway. So there are huge opportunities through the stroke strategy to redesign it, to make it more effective, to make it better for patients, and ultimately to make it a more cost-effective service. In so doing, we have a huge opportunity to genuinely engage patients and their carers and families in describing the redesign of services. So we have a blank sheet of paper here, and we have the opportunity to redesign those services completely.
I think this field of stroke is really exciting at the moment. I think the stroke strategy has pulled us all together. It's giving us something to work towards. It's given us goals which you could achieve. We've got thrombolysis for acute treatments. We've got increase from the Stroke Research Network. We're moving forwards in so many different ways that I think it's a really exciting field to be in.
I think locally the biggest opportunity we have is for developing a specialist stroke team in the community. That will enable patients to go home where they will want to be as soon as possible, but still have the specialist care.